Hi, welcome to Gynaefacts. It's a series of medical videos which teaches women everything they need to know about themselves. Hi, let's talk about blockage of the fallopian tubes. The fallopian tubes are a pair of long, narrow tubes which connect the ovaries with the uterus. The tubes are an essential organ in fertility, as a sperm cell fertilizes the egg in the fallopian tube before implantation in the uterus. About 25% of women with infertility have a segment of the tubes or all of it blocked. Most individuals with blocked tubes have no symptoms until they try getting pregnant and are unable to do so. Fallopian tubes can be blocked as a result of the following. Number 1, infection. Infections are a major cause of tubal infertility. Pelvic infections can be caused by sexually transmitted diseases, miscarriages, sepsis or infection after delivery, or after termination of a pregnancy. STIs. These infections account for more than half of the tubal damages found in women. They are caused by a combination of chlamydia trachomatis and Neisseria gonorrhea. They occur commonly in young people with multiple sexual partners. In sub-Saharan Africa, the burden of STIs is huge, with most of them being poorly treated. A single infection with chlamydia or Neisseria gonorrhea will increase the risk of tubal damage by a whopping 18%. With a second infection, the risk rises to 34%, and a third infection puts the risk at 50 to 60%. Women could get infected with one or both organisms. They could lead to damage within the lining of the fallopian tubes, adhesions outside the uterus, which affects the tubes also. Long-term effects include pelvic pains, infertility, and ectopic pregnancy. Infection could also follow a pregnancy. If childbearing is poorly managed or a miscarriage is poorly managed, patient could develop infection within the lining of the uterus, especially when products of the pregnancy are retained. In a bid to remove these products, curating the lining could damage the sensitive endometrial cells, causing intrauterine adhesions which could occlude the cavity. Number 2, endometriosis. Endometriosis is a condition in which the tissue which lines the uterus is found inside the muscle of the uterus or in the pelvis. It could damage the fallopian tubes by causing distortion of the tubes and limiting the movement of the fimbrial. The fimbrial is the structures which picks up the eggs following ovulation. Number 3, tubal occlusion or sterilization. Women may opt for tubal ligation when they feel they've completed family size, and then later change their mind and wish to conceive. Such women are usually counseled for surgical reconstruction or an in vitro fertilization to assist them get pregnant. Number 4, complications of surgery. Previous history of an open surgery is a risk factor for tubal damage. Complications post-surgery leading to pelvic infection could damage the tubes. How do you prevent tubal damage? Practicing safe sex is key in reducing the risk of sexually transmitted diseases and their long-term challenges. Laboratory screening of women of reproductive age for chlamydia infection and gonorrhea disease, and aggressive treatment of suspected pelvic inflammatory disease will reduce future complications. It's important to know that the sexual partners of patients must be screened and treated quickly to reduce the risk of a reinfection. The management of women undergoing induced or spontaneous miscarriage should include using hygienic sterile materials, minimal curating of the uterus, and antibiotic coverage to minimize the risk of post-abortion pelvic inflammatory disease. Thank you.